There we go. Finally. Yeah, mock-ups on the signs.
Oh,
Yeah, here it is, but I haven't got, I haven't gotten them for Brian. There's the.
awesome.
Yeah, I think there's a picture on there. It's less have to be going to the house next door.
It'll
I
help.
really don't wanna,
That will help.
really don't wanna. Oh, good, he took the two pictures. One shows the lower level popping out, which is.
Good.
And the QR code
Mhm. And the QR code goes back to our IT.
goes back to our IT. John had set it up and gave me the QR code,
Wonderful.
so that will. Yeah, the sooner the better we get that up there.
It was nice to see Sean down there for emergency management this past week, wasn't it?
Did you see that comfort dog that they had down there,
Yeah.
out there?
Yeah. Can't remember its name. The golden lab, the yellow lab. Was it a golden
Yeah,
retriever?
it was.
It was light colored.
Yeah, I think it was a lab, but very mild temperament, beautiful temperament on that. And puppy, they had this comfort dog down there and that thing just rolled over on his back and he sat there and scratched my belly.
He enjoyed the attention.
He was really, she was really into it. It was a cute dog.
I can't remember the name.
And apparently those dogs got a real workout over there on the northwest corner when that flood hit out there after the flood. Oh.
Searching.
Mhm. Can I get from here and get it printed?
Good morning, Krista.
Did you see the big picture of it? Oh, no.
That's their requests and things that they want.
Yeah, actually, we have it mapped out really nice too.
Here is Stan. QR code goes to the county website. Ben's number up there for follow-up.
It's your handiwork.
Not mine, that's Letterworks handiwork, and he's got, good thing is he got two pictures up there, which shows the walkout and less apt to be seeing the knocking on the door next door of the neighbors.
Like showings, starting. Right, it's under that auction. That's the.
Well, I think we can do that off that QR code, because it's gonna go.
Look at it. The other one. Winneshiek. You know, it looks like that's the date it's gonna be done. Like starting. But otherwise, great pictures are nice. Yeah. Oh, boy. You want it?
No, the other one.
Oh,
Paper one. We get it here and then we get it in our mailbox. This one. You get this one.
At home?
Yeah. I do.
Okay, no, I didn't give her what is the correct one. We all got it.
Yeah, yeah, I'm about that. But it's weird to get to.
It doesn't, or it does. I appreciate it. I got shot in the foot. With the what? Shot in the foot. Humoring. Yeah, this one is also. That's from the Dr. Pepper. Really? Wow. That's impressive. Just give a little. Really?
Clean up my own bag.
You run the game. You are here. Yeah.
Do they badge access to the conference? Badge access?
No,
There's some things we can say no to. Pretty high.
this door,
Oh, that's why it's here. It's.
fob entry,
That entry is just there sitting with the,
no, fob entry on that one. This door for sure has got. Come from the lunchroom side to get back in, and I think that's what we're
Now taking it
the
all.
other two doors too. Yeah.
Yeah, that's.
that
That one. That's. No,
Still in the hospital? Not doing well as far as feeling. The back part of the surgery went well, but she isn't recovering from well, she can't eat, she can't stand up without getting dizzy.
Anesthetic thing.
It has to do with the spinal fluid that leaked out during the surgery. So. Yeah. She was great. Wednesday night after the surgery, she talked and ate. Now she sleeps and rolls around in pain.
Young man, I know I was in Nevada had a surgery personally because that turned out with the brain, ended up back in emergency a couple of days later, with a brain leak and excruciating pain. Ready to go back in and do a second surgery.
Yeah, that was something they would be considering. They did an MRI over the weekend and they were gonna wait for the surgeon to look at that and decide if they needed to go back in.
Yeah, this is- Sure.
I think she's okay on that end. She hasn't been feverish or those kind of symptoms. Yeah, I did that after the meeting.
They put me on a caffeine drip when they got the spinal fluid on me. That's a
I
massive headache.
she even drank a bubbler. And because she felt well enough and then it. Yeah, well, with bubbles. And it kind of hit her on Thursday evening and.
So
She
sorry.
lays there and squirms in pain and
So sorry.
I got. Now, the parents to be sitting there and like, you can't do anything. Except do best for her.
There's somebody that wrestled for how long with them, so she could take pain.
Yeah, yeah.
It is 9:30. All those that so choose, please stand for the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Call the meeting to order with everyone present. The meeting is being recorded. If you choose not to be recorded, you have the option of leaving. First item on the agenda this morning, Krista VandenBrink, Public Health Director, update on the data collection. Morning, Krista.
Hi, Krista. Couple ideas what they need to do for your daughter, but yeah, I'm not in that field right now. And everything that you're describing is. All right, so I know part of the question that you have had is, should you fund Northeast Iowa Area Agency on Aging and how does they fit with public health? And so, first of all, we know that they are two distinct separate agencies, but I wanted to describe a little bit how they differ from us, right? So, not gonna talk about me, I'm gonna talk about NEI3A. So they are a referring agency, okay? So people sometimes will start with them, and it's for individuals all over the county, and I know that NEI3A serves actually some other counties, and I'm not going to speak to which they are, I don't know. But they have social workers who will help to get people signed up for Title 19. And that they also do some other direct service as far as, again, the coordination. They don't have nurses, they don't have aides, they don't have homemakers. They refer to different agencies. And here in Winneshiek County, they would refer to WinMed if it's appropriate. If somebody needs that skilled type of level of care, they would refer to Winneshiek County Public Health if they need that level of care, or they might refer to Loving Touch. Okay, Loving Touch offers some home care aids, so personal cares, as well as some homemaking. I have some information to show you that they're full. When I've tried to talk with them, hey, can you also do this? We have a referral for this. She's like, we're full. They've been full for the past couple of years. Okay, so they are a completely different entity, right? They do a lot of work with the home delivered meals. But they do that type of care coordination. So we don't have the social workers. They have that, again, to make application for Title 19. They are a benefit to us. They have given us several referrals. We've also collaborated with them to say, we need some additional services in this particular home. Many times they're already aware of it, but sometimes they just need the boots on the ground people to be able to say, yep, we've been able to justify and verify that they need that type of service. So they are a supporting agency for us as well as for many others. So I just wanted to share that with you. Maybe that will help to clarify some things. They did not pay me to say that. That is the honest to God truth. They are a really good agency that we work with. And so what I have for you is my homework, basically. It's a chart, and I've tried to make this as simple as possible for you. Okay. So what I've done is to talk with the other administrators in the other counties and find out what kind of services do you actually do. Okay, now I know some of this, but I didn't just go ahead and put it on there. I actually tell me what you do. Okay, and so care and maintenance of people. So we're talking about some of the healthcare maintenance, like what we do. Okay, we have a handful of people. All those other counties also have a handful of people. Okay, we're not talking huge numbers, a handful of people who are needing that health maintenance. We are providing those personal cares, so caring for the frail elderly through home care aid services. And then notice that there's a few of us that also offer the homemaking components. And we also have loan closet. So loan closet, I've included that in there because that includes walkers, wheelchairs, people that are coming in for that type of service so that they can go home and be as independent as possible. Sometimes those people need our services, sometimes they don't. Okay, so then moving down to the skilled nursing services, and so, skilled nursing is what like WinMed offers. Okay, where they're able to bill Medicare, they're able to bill the VAs, they're able to bill Medicaid. So I wanted to make sure that I would clarify that for you. So obviously, we don't do that, so I'm not going to mark that we do that, okay? But Chickasaw, Elmucky, and Howard do that. Fayette, they have a Gunderson Home Health. So they are completely separate.
Can I ask a quick question?
Yes.
In Howard, I thought their public health was all through the hospital.
Uh-huh.
Is that why you're marking down that they offer it?
They
Because
also
they're
do the skilled nursing.
separate from? in the
It's all
hospital?
together.
Okay.
The hospital does it. He said,
It's regional health services at Howard County. They have their home health, they have their public health, all part of the hospital.
Right.
Okay. So
it's the reason we don't do Medicaid because we decertified,
because we decertified,
and we decertified because we didn't have staffing.
because we didn't have staffing. Yes.
Can we get recertified?
You're gonna have to move mountains in order for that to happen. It is a lot of work to recertify. It's also expensive to be certified because there are a lot of rules and regulations to adhere to. So, yeah, okay, so on the next page, I listed the different population health services that are offered. So this could be considered public health services. So these are the things that everybody's saying that they do, okay? Notice like Chickasaw, they do a lot of things. They do their blood pressure clinics in the community. Oh, sure, we could do that, and in the past, we did do that. We don't do that anymore. We quit doing that several years ago because the hospital went out and did that. That was several boards of health ago. Doesn't mean that we shouldn't go out and do that. Okay, so, vaccines for adult, vaccines for children, those are different contracts that we all have. Some of us do different levels of that, meaning the volume that we have is a little different, okay? Emergency preparedness, communicable disease, those are parts of different contracts that we do. The community health assessment, that's part of our local public health services contract. Again, we're all required to do that, okay? Different seasonal vaccinations. So some of us might have to rely on other people to come help. So for instance, in talking with Fayette, they have to have some assistance from some of the clinic nurses come over because they don't have enough staff for that. We'll get into that. Community education is a very broad category. So that's all of the talks that we do. It might be CPR, it might be stop the bleed. It might be just general health talks about how can I prevent dementia? How can I do this? So that all happens in there. School health, that happens on varying levels as well. We have a couple of non-public schools here in the county that we provide screenings for those children because they don't have a school nurse. Okay, so clients and staffing. So I asked that question too. How many clients do you have? What's your staffing? And so I broke this down as well. So please note that I talked about skilled clients. So this really means that clients that are billing Medicare, but this would also mean the handful of people that they are taking care of. So I said, just how many clients do you have? Boom, this is what they've got. Okay. It gets a little dicey when you try to separate all that out. It gets very confusing and messy for people. So I just put a number of clients. So that's about the number of clients that they have. Clayton, they didn't get back to me with some of that information. And Fayette is, again, they're kind of a little different in how they do things. So you can see what that staffing level looks like. But you also asked about other agencies that come into counties. So for Winneshiek, skilled nursing and hospice would be offered by WinMed. Now, if they're going to be skilled nursing, they're also going to hopefully have access to a home care aide from the hospital. But from what I understand, they're full. They're having to turn away some clients, some of those referrals. Okay, so there's a need out there, right? Again, for Winneshiek, for other agencies, for personal cares and for homemaking, got Loving Touch. But in talking with them in the past, they're full. They don't have capacity to get anybody else on either. But notice in all of the other counties, they don't have any other agencies that are coming in either. Okay, there might be some private agencies, all right? Clayton has kind of a unique situation where they're positioned, you know, they have some of Gunderson from Fayette County is coming in there. Crossing Rivers from Prairie is coming across the river. And Almakee comes down a little bit into Clayton County. But there is a care desert in Clayton County as well. Where some people, if they've had a new knee or a new hip, they might be looking everywhere to get somebody to come help them. I know we had received a referral, I think it was from Crossing Rivers for Clayton County. They said we can't provide that service. So I suggested that they call regional out of Manchester. I don't know. This was an individual who actually lived in Elkader. So there is a care desert, all right? So this is, I think, what you were looking for in trying to be able to figure out some of these things.
What's the number for skilled clients for Winneshiek?
We don't have skilled clients. So I have that sheet that I had given you before. Our handful is about a dozen clients.
How are you, give me the description again of skilled clients.
So skilled means that they can bill Medicare and Medicaid.
That's definitely meant.
Yes.
Right. And so, again, in trying to capture that information, their number of clients, they just included everybody because that's easier to figure out with what their census is. Okay?
Just to clarify, because Shirley kind of asked this earlier, but how many of these, like when you're talking about staffing, how many of them are county staff versus some sort of medical facility? So like, I think like Winneshiek and yeah, it has county staffing people, where
Chickasaw,
is it Chickasaw?
Chickasaw.
And the others, their public health is run through another facility. So these staff are talking about how many people at that facility. They aren't actually county employees.
This is the number of staff that they have for the services that they're providing.
Yeah.
Yes. So Almakee, yes, they are hospital-based. Howard is hospital-based. Fayette is, they're housed in the hospital. But they run their system completely different. They don't call themselves public health. They call themselves population health. And when I've talked with friends who live in Fayette County, they have questioned the existence of Fayette County Public Health. I said, well, what do you mean? I said, well, I don't know what they do. So they don't feel that they're vocal enough, apparently, with the
There
services.
weren't very many checks on the first page in their column.
Right. Right, exactly. So they do, obviously, they do services. It just looks a little differently. Okay?
There were things like during the pandemic that, like coordination of the vaccine or something that had to start with a public health agency. And so they obviously have something. It just isn't like the same as the rest of it.
Correct. It looks completely different. Even from the other hospital-based agencies, they look completely different. Now Clayton is, their mothership really is Dubuque County VNA, Visiting Nurses Association. Out of, used to be Finley, now I think it's Unity Point. So that's who oversees them. But they do have an office in Elkader, and they do provide services. So for homemaking, the Board of Health did discuss this at their meeting. And so they have agreed to make a rate increase in that. We have to notify our clients, and so I'm not at liberty to share that with you yet because the clients don't yet know about that rate increase. Okay. We also have to keep in mind that Winneshiek County, what I'm handing out is the county health rankings report for 2024, which is the most current information. So our health outcomes and our health factors. Winneshiek County has habitually been in the top 5. We usually have to do battle with Dallas County and with Sioux County. And I have relatives in Sioux County, so it kind of makes me a little angry that I have to battle with them. Because we know that we're better. But you don't get to be in the top 5 without good, consistent care delivered consistently, right? And so I want to make sure that you can see these maps because our surrounding counties, other than Chickasaw, you know, they're not quite as good as we are. And so we're lucky. We have people who come to live in our county. We have a diverse population. Yes, we have maybe a more affluent population than some of our other surrounding counties, okay? We maybe don't have some of the issues and problems that those other counties have. Not saying that we don't have problems, but when you provide in-home care to people in their homes, it helps their mental health status. It helps to provide some of their dignity, which does affect their health factors and it does affect their health outcomes.
This is
Dick,
something good to see that there aren't any yellow ones or purple ones
Yeah.
compared to other states. I mean, the whole state is at least in the
Right,
average or higher.
right. I know, I saw that too. I was like, oh, that's
Surprising. We're #1 in rising cancer rate in the country. This is surprising.
2025 may change this. We don't know. So brought you the homework. Questions that you might have regarding this or questions that you have regarding NEI 3A and how they fit in with any and all of this.
I guess the biggest thing is what other counties paying. I mean, we have that chart that we got earlier, but that's what they're paying compared to what.
So again, keep in mind that hospital-based agencies, supervisors are giving X amount of dollars to those agencies. However, a hospital is having to backfill because if you take a look at those or if you take a look at the number of staff, you know that the hospital agencies aren't getting by with just paying $175,000 to cover those wages.
Plus, there's things like the public health grant or other grants that you have maybe gotten that the hospital could go after if they were providing those
They
services.
get those grants.
Yeah.
But they have to go through different steps.
Right.
It's a subcontract. So there's a few extra hoops. They don't get any extra dollars. It's all based on population and the number of elderly in the county. It's not based on the number of dollars that you get from the supervisors. It's a set amount. So they do get those different contracts. It just looks a little different.
They have found that they have to reduce their public health budget by 25% because they can't afford it either.
Where's that information?
It's online. You can also, I talked with one of the supervisors last week. And that's also, and you'll find it in newspaper articles. They announced a 25% decrease in public health.
I think you're talking for Chickasaw County.
Chickasaw.
You said Fayette.
Yeah, Fayette doesn't seem to have a problem. I don't remember what the number was for Fayette.
What was the number you had?
Yeah, Chickasaw, they were up there at 500,000.
They were about 22 against ours, I mean, by comparison.
And they do offer a lot of.
They have been, haven't they? They found out they can't afford that, it appears.
The Chickasaw County was actually going to be getting more in county tax dollars this year. the 500, I think they were closer to, I mean, they had a budget, overall budget of 1.4 million.
Chickasaw public health.
But they get Medicaid.
But they get
They get
Medicare,
Medicaid,
Medicaid reimbursement.
And that chart that I had prepared for you that had the net dollars, so it took into account total spending minus the
Net cost.
minus the grants or public health money from states or whatever it was.
That was the net cost.
What comes out of the budget.
Krista, what did you say Chickasaw's budget was, 1 point?
Their budget was 1.4 for this current fiscal year.
Chart I had distributed was last fiscal year, so I didn't have.
That was their net cost.
Here's the public health budget, the one that we cut in half basically was 1.2 here, but the net was like 700 or something, 700 and
Yeah.
some, because there was a lot of income too, back when you were still
Certified.
Correct.
certified, yeah.
Correct.
So
But the net cost was 700 and some thousand.
by cutting the expenses in half, you didn't cut, by cutting the expenses in half, you didn't cut the net in half, because
No.
you also lost a bunch of revenues.
Right.
So.
We were still at that, we were still like 250,000. That was for Chickasaw County. Would have been if everything would.
And just to keep in mind, like the homemaking, we're not talking Alice from the Brady Bunch, okay? We're not going around and doing the baseboards, right? We are doing the hygiene that needs to happen in the bathrooms because people maybe are using incontinence materials. Okay, so cleaning up after that, taking out the garbage. Doing the vacuuming or the mopping of the floors in the bathroom or in the living room, kitchen, because somebody with a cane or a walker can't safely vacuum and mop. Okay, cleaning out the refrigerator, making sure that people aren't eating spoiled food. We're helping changing the bedding. We're not doing the parenting that sometimes Alice did. We're not playing the basketball with these clients. We're actually doing the hygiene things that make a difference and help to keep people at home.
And how many are we homemaking for?
I don't have that number, but it's about a dozen or so. And the homemaking, remember, is private pay.
That was that chart you passed on a couple weeks ago
Correct.
that had that.
Correct.
There were a few that didn't have any payment method, and then there were a few that paid
Right,
the full part, and then I think there was one that was like on a sliding.
correct.
That could afford some, but
Homemaking,
not.
we got 4 clients that are homemaking.
No, I don't think that's quite right.
That fits on here.
That and on the back page
Yeah.
there.
Yeah, there's just homemaking is 4.
There's more than that.
There's some more on the back there.
There's 1 here. And there's 3 here with homemaking, HMK abbreviation, 4 of them. Not home healthcare aid, homemaking. There's 4 clients.
And most of those were in the green section where they're
Yep, they're all in
paying,
the green section.
so they paid for that. And there'll be the new rates that.
We've had referrals, and so that information is already updated too.
Cost us roughly $250 an hour, or $247 an hour to furnish that. You figure all the expenses in the building, the IT deal and labor.
Does anyone have any other questions for Krista?
Oh, do you have more to offer here today? Is there something more you'd like to talk?
So I know that Steve Slusser was here last week from the hospital. And you had questions about home health, and he even said, you don't make money with home health. Okay. He also said that we do things that they can't, right? And so keep in mind, and I've said this before, they are only going to take people who have a payer. So those few people that we are providing that adult health maintenance, they don't have a payer. Okay? They can't afford the per nursing visit rate. That would also go for the home care aide. There's no payer for them.
So my question, my colleagues would be, where are those people supposed to go?
I have obviously in the paper with the uncertainty of Medicare and Medicaid. A lot of the people that they probably assumed from us will end up coming back to us potentially because there won't be pay.
That is a potential, and we have to figure out what does that look like.
So I think to dismantle what we have any further at this point in time until we see where the future is going to be isn't a smart thing to do.
It's a
But,
very scary
yeah,
situation.
Can we look at things and maybe, I would say, have people from the health board, you, WinMed, whoever come in and sit around the table and figure out how could we potentially navigate the future and could they do more or less, or can we do more or less, or how is that going to be? But unless people sit down and have a dialogue and talk about how can we deal with the budget and take care of our citizens the way we need to do. If we don't do it, I suppose some would go on Title 19 and the federal government would pick it up, but maybe they'll cut those programs too. So it's not.
But you can't, at $250 an hour, that's way, you can't be having that kind of expense.
If the,
That, I
Well,
mean,
but you can't.
you can't have that kind of expense to do something
But
in home. And that's what it's costing us, Mark.
That's
It's
why-
$247 an hour.
That's why we need to sit down and figure out how we can cut that cost.
That isn't that's the Board of Health. I mean, it's right here in black and white. You dissect the budget, that's what it costs, $247 an hour. I took the 2 part-time nurses and I excluded the 1 home health care person we don't have now. I took them 2 part-time nurses and the 3 out of the home health care deal. You total that up, you got to take part of the rent, because if we didn't have all the people, you could cut down to half the building size. And that IT, that's $60,000 a year. 3/4 of that you can put towards this year, because that's a lot of billing and where all the stuff comes. So, I mean, the figures, they're right here. I went through it and yeah. It comes to roughly 1,376 hours a year with home health care, and that's figuring the foot clinic in there too. That's what it costs an hour to run that entity per hour for the year. And it's in black and white right here.
So what I'm saying is, if people had dialogue and maybe Loving Touch could hire more people, we could contract with them to do something. I don't know, but
You can't hire any more people because we're only dealing with 13 clients right now. That's costing $341,000 plus your foot care people, $341,000 for 13 clients. I mean, if you're gonna start doubling that, you're gonna be 700,000. I mean,
I think what Mark is saying is there a more efficient way where?
there's gotta be a way more efficient way.
Where
to
we
do it.
could pay
that's where we,
some amount of money to Loving Touch or some other entity and let them hire the people, not us.
I'm just saying,
It's here, way
I
out.
think we're not doing due diligence if we don't figure out a way for people to have an option if we're gonna cut these programs.
well,
And that's where having people sit around a table and figure out how we can do that.
I would suggest maybe Dan and I can go meet with the hospital, have Krista attend if you have time, and have that discussion around a table. Would you be willing to do that?
I'd be willing, yes.
I think that would be great.
Okay.
And potentially see
Maybe
if
even.
Loving Touch has the opportunity to expand if they had funding to do
Krista
it.
has 1 or 2 of her Board of Health members too,
Yeah.
because they're the ones who have to
Make the decision.
make the decision. So you can help coordinate and initiate it, but they have to, working through Krista, have to make.
Well,
that.
let's work to put something together there and have a meeting.
the efficiencies don't make sense to me when I sit and listen to the hospital on their annual report from the home health and hospice division. Were profitable for the year. So their efficiencies are certainly much better than we're able to do at the county level. And that has to be explored. We have to be able to
But
explain why.
they're also
So much
taking the
disparity.
ones that have Medicare and leaving the other ones out.
Right.
But that doesn't mean that their efficiencies aren't significantly better than ours.
So I think the goal is that maybe you can, for some amount of money, it's less than what you have already spending, you could get someone else to.
To do
Yeah.
it more efficiently.
That's what I think the discussion.
That's what I'm talking about.
And we're obviously gonna have to have this discussion down the road.
Well, I think we better direct the Board of Health to arrange for a sit-down meeting. I mean, we need to pass it on as
Well,
a directive from us that they're gonna to sit down and have a discussion.
that's what we just talked about them doing.
We'll have that initial discussion with Krista, maybe a couple of board members, and see if we can get the hospital to sit down with us and then take her from there.
That would be great. Thank you.
All right. Thank you, Krista.
Thank you.
Next item on the agenda, Mike Kueny, county engineer. Thank you for being patient, Mike.
Busy morning, so the report came out as the meeting was happening. If you can compare what I have on here to the agenda.
Don't take any action for a minute.
I can just go through what's happening and what's gonna happen this week. So Winneshiek County, the finalist for the bill grant, no news is on that. We did more coordination on the rail car bridge, trying to determine when the best time to do that was, and doing, talking to Chuck Whitson, we need to have our bridge to box culverts inspected. They're done on 5-year intervals, and this is 2025. So we have to. We'll be working on the agreement on that. What we have from Chuck Whitson, we have the guy that used to do it is no longer there, so I'm kind of feeling our ways through that on the agreements. Subdivision, same as last week. A lot of my time this last couple of weeks has been for the maintenance activities for 2025, and I met with Foreman just an hour ago on all of that. Still trying to figure stuff out. Winneshiek grant application with emergency management to obtain a generator transfer switch was denied earlier last week. First week with Darren Barta as superintendent went very well. Bridge 126 variance was requested last week. We will meet with DNR about that this week. Second week of road embargo notifications, 43 permits have been filed. Length of embargo is still unknown. A road maintenance worker 1 resigned last Friday. We have hired an internal candidate for his replacement. I have not confirmed that the candidate that I intend to hire have not confirmed with him yet. And then presumably a new opening for the bridge crew will be posted later today at the internal level first. An all department safety meeting met on Wednesday. Had some excellent safety videos we went over. If you're interested at all in worker safety, let me know, because Linda Moyna was provided some excellent materials there. ISAC met at the end of last week. I did not attend. I was scurrying about here trying to do maintenance activities. And then on Friday, was notified that Jeff Peel had not done all that was requested of him. So that came about at a minimum. I put another lock on the chain gate. working with lawyers on that, and I'll let you know more when I know more. I can't really tell you much on that, other than he's got a tree down on our level B road there, and he didn't have a lock, and then I'll have to compare what you said would be done on the riprap, because
That's removed though, correct?
the riprap to the gate that he left in place, which should have been replaced, has been removed. Past the gate and what exactly was supposed to be done, I'm gonna have to review the documents. All this happened on Friday, so it's not expected on Friday. Let me just put it that way. Preliminary plans for Nessie Valley was sent to Urban Engineering at 5 p.m. on Friday. I think that basically we'll combine our permits and all the mobilizations. We intend to do all of it ourselves. We just see what that looks like. I think I copied you on an email I sent to everyone, so that has more information plus the soft copy of the plans at their preliminary level. Corrugated metal pipe quotes have been received. Let's see. Are we supposed to, the board supposed to?
Yeah, we approved it.
Yeah, I just am kind of ambiguous on how that works, because other things aren't. So here's the quotes. Oh, that's 24. Sorry. There we go. So we had 3 bidders. The Iowa Metal Culverts and then Northern Iowa Construction Products were the 3 bidders that came in. The Metal Culverts Inc. Is the best bid on all pipe except for the 30-inch. And they're, I'll call it, relatively competitive on the 30-inch, so I recommend awarding the pipe purchase bid to.
It's all or nothing deal with these.
That's what the whole point is, yes, that we just have them on order.
No, what
I move to approve the metal culverts bid.
You can't split it out.
Well, that's not how we've done it in the past, so if we can just table that vote for 1 second. So, me following in past footsteps, this is how I've always done it, so that way when we go and say, we want this much pipe, we get all of it all at once for one price. Otherwise, what happens is the price can change at any given time. We're locked into a contract.
Plus, if you said, say, we're gonna buy our 30-inch pipe from this place because it's cheaper, and then everything else from this place, you'd get multiple delivery fees and all that stuff.
It's a headache. Now, does that mean it's not, at some point that doesn't make more financial sense? At some point it might, but for something like this, I mean, I'm talking about one pipe, so I had the thought that, just like you did, that, that's not always ideal, but for something like this, and 30 inches is an odd size, I'll just.
What's the most common pipe we use, Michael?
24, 36, 48. I mean, those are gonna be the most common ones, so, yeah.
And the other 6 are cheaper, so.
Yeah, I mean, by a lot. It's just one of those things. I just brought it up because I wanted to highlight the highlights on that. It doesn't, I didn't run a percentage calculation, but the prices compared to last year are small increases, 1 or 2%.
Oh, it's so bad.
way better than the rock.
Yeah.
I'd say.
All right.
You know, we're on all those pretty common sizes. They're the best price.
Yeah, and even eight, I mean, you don't usually put 18-inch in, but 18 is another common one, but the 27, I don't even have 27, 30, 42 is.
Okay, well, we have a motion and a second to approve the bid for 2025 culverts from Metal Culverts Company. All those in favor, say aye.
Aye.
Those opposed, same sign. Motion carries unanimous.
Didn't come with us.
We have not covered that yet. No, I was thinking of that. All right, the thing that I skipped over that Mark pointed out here is that we are looking at putting 6,500 ton per blade district. And then outside of that 6,500 tons, we're gonna place rock on high volume roads. How much rock is gonna be a budget constraint on that? But it's a little bit different than we've done in the past. In the past, we just put a blanket number and let the blade operators figure it out as to which roads and how much. Just River Road, parts of Town Line and Conover Road are all examples that we're gonna throw more rock on outside of the 6,500. Last year, we put 5,000 ton per district. I was skimping on rock to pay for other things this year. Basically trying to get things to be an operational level. I've been told that this still doesn't make us operational, but I can't, the demands are too high for to put the kind of rock that people are requesting on the roads. I can't compete with the Howard County at this time on the amount of rock that we're putting on. So that's what we're doing. It's again not ideal, but something that is better than last year. The number of roads has not been determined yet. It's something I will be working on today, at the end of the day, to see how much we can put in there. It might cause me to amend my 2026 budget. But as of right now, 2026 budget still looks reasonable going forward. What else? That's about it on that. I sent an email last Monday on the engineer manager job description that I want to send to Condrey, so I'm going to ask that we vote on that. Or have discussion if you'd like, if you've read it and would like to have a discussion on that. I have another copy if somebody wants to read the job description right now. For the engineer manager position.
Engineer manager.
Yeah,
I would move to approve the job description provided to us for the engineer manager position.
So I have one question. So we're up in their job descriptions. We're getting by with the staff we got now, must be evidently, because we've up how many other wages. So then we hire a office manager or whatever. So once we hire him, do these job descriptions, I mean, everybody's gonna be doing the same thing or what? I mean.
so the number of personnel I'm trying to keep the same. So if I'm looking at it from a 5-year, 10-year down the road, trying to keep the number of personnel in the courthouse the same. Ideally, we would have I don't know, call it 1.5 assistants, engineering managers, so to speak. And so part of the duties of who we hire next will be to do the engineering manager's position. There's going to be HR involved. There's going to be HIPAA related stuff involved. And the person that we hire is also gonna be, gonna have be PE eligible at some level, and they're gonna have to do, so, they'll be out of the union, so there's likely gonna be a reasonable amount of overtime in their position, but absolutely, they will be expected to handle a lot of these duties here, going forward. And so these duties are already being handled by the staff we have, and we are deficient at, on the design side of things. They're always busy, and there's opportunity for us to do some of the bridge inspection ourselves. There's lots of opportunity for more work in that staff. So I'm trying to balance who we have, because we have excellent employees in the courthouse, and then I know, because the communication that I've had with the staff, you know, when they're looking to, you know, retirement. And so, that being said, I'm trying to look at this as I'll call it a 5-year plan, because we have one of the engineering managers who's looking to retire sooner than we need, and then so
Somebody in.
get someone in, so there'll be a year where we have 7 instead of 6. And then I have some design after the engineering manager, then we have a couple of designers that we'll be looking to replace, and I can't speak for certain on this, but my guess is that who we hire will be at a lower price, because it'll be either entry level or close to entry level at that time. So I am looking at this from a dollars and cents perspective. We are gonna have a higher, once we start onboarding our 7th person, our PE ready person. Once that happens, we will have a higher payroll. And then once the retirement happens, then we'll be back on track. What I will say is, our payroll has gone down even with the increases over the last 3 years. So there's a little bit of, we got a lot of reset, tried to make sure that our guys are paid so that they don't just jump ship to the next best thing. And I think the last union negotiations that happened does that. And then
I'll just say it bluntly to save you. I mean, Michael's cheaper than Lee because he's a bit less experienced, and we have 2 assistants to the engineer that are both cheaper than having an assistant engineer that we had before. So that is saving a significant amount of payroll money at that end. And so Michael's trying to utilize some of that you might have been normally been spending to be ready to prepare for this transition over the next few years.
yes, that is the most blunt way to put it.
I think it's a wise move to prepare,
Yeah,
especially when you know it's coming.
I try to talk to people almost every day. I don't get to talk to the crew nearly enough. But trying to plan and be ahead of the game in terms of HR, I think is a very important thing. And I think as far as that's concerned, I'm ready for what happens next.
Okay.
So
Second Shirley's motion, I think it's a great plan.
And speaking of being prepared, I think, and we'll have to go back and double check, but just in the next couple months, I think your contract was just through this June.
Yeah.
We'll have to be addressing that too as we move through the next few months.
My next question.
Yep.
We have a motion and a second to approve the job description. Is there any other discussion?
the motion is for us to negotiate with Condrey on this one, right? Just
They approve it and then you submit it to Condrey next.
okay.
Now they come back with the rate.
Yep.
All those in favor, say aye.
Aye.
Those opposed, same sign. Motion carries unanimous. Great work.
Yeah, I don't have a copy of the agenda. Is there anything else that I've left off on the agenda?
No.
No, all right.
Thank you, Mike.
Thank you. We'll skip over the miscellaneous right now, and then we have Andy VandenBrink, county attorney.
Andy,
Morning, Andy.
what do you have from? Yeah, to approve, I just put it in a year time slot.
So the DHS building, I updated that to reflect the bid off, at the end of it. And I think the rest of it was, we were good to go with last week, as I recall.
So it's a resolution setting the public hearing and the bid procedures.
Also, John did get a, web page built so that all this stuff can be uploaded to that. There's a link, in the stuff Ben has, so hopefully we can help publicize a little better that way as well.
Do you want to pass that around, Steve?
Steve, just get a mock up of a billboard.
This was the mock-up of the billboard. And with a QR code referencing a link to that
To the website.
webpage. I see the change on this is we changed that date up there. I'll direct Brian to change it to bids. Bid deadline is May 9th on that. Mark brought that point up, and I think, that's clarifies it better.
Would someone like to take action on this procedures for the building sale?
I'd move to approve the resolution.
Second.
A motion and second to approve the resolution for procedures for the building sale. Mark?
Aye.
Joey?
Aye.
Mark?
Aye.
Steve? Aye. I also passes unanimously.
Your signatures on the second page.
We had that Farm Bureau meeting Monday night, they let us, and they come up with now if you're here, they come up with a resolution on ordinance for solar panels. Because if they're gonna put a battery storage down at Lansing, they're gonna be pushing hard to put in solar farms, solar panels to charge that battery station. So they come up with, Clayton County did do an ordinance on utility scale solar installation. And they, Farm Bureau kind of highly recommends we would do the same. If they
Is
put one
that
up
in
in
the-
Wisconsin on top of the hill up there, and there's,
Is
it's just terrible.
Clayton County's, is theirs tied to their zoning ordinance?
I don't know, they gave me the copy
I
of
mean,
it,
it seems to me that would
yeah.
be a better fit than just an ordinance, sitting out.
They recommend we do something because they put one up in Wisconsin up there, and it's just 200 acres and it's just a mess.
I think maybe, Tony, or I can have Jana do it, but bring it up with P and Z and, because we do have,
I can drop this off until,
apologize, I haven't looked into this recently, but when we have had some solar farms put out there and they have required, I mean, typically
Okay.
from A1.
yeah.
So it may be something that requires some fine tuning, but I don't.
Yeah.
I
He
think
gave me a copy, this here was just a copy of what the Clayton County.
Does Clayton
ordinance
County
is.
have zoning like we do, or maybe they,
I thought they did, but I can't.
I don't
I mean,
remember.
I'm just thinking about all the issues they've had down by Monona with, I think that's in Clayton County. I thought all of that was zoning related, but I could be wrong.
With what?
That recapture, that beef.
Yeah.
cattle,
That's different than the solar farm though.
Well, I'm talking about whether they have zoning or not.
Oh, yeah.
Yeah,
They were also discussing, there was another area where they had 700 acres.
yeah.
What's the downside of a solar farm?
Well, just to have regulations on there, how they do it, because that one up there, there's no regulations, it's just dirt running everywhere. goes right over the road, burying the road and
Yeah.
everything.
So to have things in place to stop that runoff
Uh,
under construction.
Or even the size of
I
it
think
or
it
whatever
needs to
you
go
want
through
to do.
something.
Well, there's one proposed solar farm, 4,800 acres, so those things become pretty concerning. You know, that massive.
Well, I mean, as long as they're managed, I don't see the problem with them, but. If you're taking, the government pays farmers to take land out of production, the solar farm pays farmers to take it out of production. It's,
That ain't what we're talking about, taking land out of production, nothing to do with that. It's the runoff and stuff and
Well,
all that off. It ain't the production part we're talking about. They're talking about, so, cause that one up there is just dirt and it's
and
running
probably,
over the county roads and burying the
and
roads and
probably
everything.
similar to
Yeah.
wind farm, you have to have decommissioning
I would
program.
ask P and Z to take a look at that. I mean, I know they're looking at some other proposed amendments that you guys are aware of. Some of that's waiting on state legislation. But this is something that could go into that package, I would think.
Yeah,
And
I'll grab that off at Tony's office, yeah.
Another issue P and Z should probably look at that was discussed in Des Moines is the
Carbon pipelines.
no,
No.
it's data gathering centers. They just had one burn up down by Marshalltown. There's been two of them burn up. They basically put up a Quonset hut. They don't have foundations, so there's no tax on them. They basically suck up all of the
ton of
excess electricity. And so I'm not saying it's a bad thing. Well, if you don't have regulations in place before they come in, there's nothing you can do about it. And they are quite noisy because of the amount of exhaust fans to keep things cool. So it doesn't sound like an issue, but it is an issue.
It was an issue.
To all of the people that are there that have them, and they get snuck in under the fact that they aren't exactly transparent on what the use of the building is going to be previously to that. So so what happened, with one place is that the solar, these data center has maybe one or two employees, and because of the energy load they take, they couldn't bring in a major production facility that would employ tens or hundreds of employees because there wasn't the capacity to support that. So I think those are things we should talk about with the P and Z and have in place.
Have that added to what we're asking P and Z to look at.
Yeah.
I would send them, either talk to Tony or send an email to maybe copy Janet at my office on that too,
Yeah.
because
And I'm sure
I
there
mean,
are,
while they're working on amendments, they may as well give you the broad spectrum.
You have like a handout from that ISAC presentation.
it just came up. Somebody says, another thing you need to consider, the guy from Clinton, where they just got,
So maybe you wanted to
Cool.
stop and talk to Tony Phillips about it so that he can research what that
Who's
issue
another guy
was.
from the-
Sandy Loney from Humboldt.
Lincoln County and Humboldt County.
So it was quite disturbing to hear that.
We do not have much power to be able to support data. That's one thing we know for a fact in the state. Without more power generation, we can't support data.
I know there's some cities that a fourth of their consumption is data.
Are you gonna work with Mike a little bit on that Jeffrey Peel thing?
Yeah, got a call back from Jeremy Thompson this morning, said he'd get a hold of Peel. He said last he had heard, he thought the equipment was here or on its way. So well, maybe, but it never got installed, so. Anyway, that, sorry, just.
We're all
So
done.
sometimes Monday mornings I'm a little more blunt than I should be. Anyway, he is following up with Peel. I'll keep Michael posted.
Do you have trial this week, Andy?
But we could, because above the jury box looks a lot better than. Thank you.
Sky's not falling?
Yes, yes, we don't have any penny under.
We did get we're in the process of some quotations on replacing the T-bar ceiling and trying to work, see if we have enough money in the budget to be able to do that in the current year yet. To finish out, so the whole ceiling is at least T-bar ceiling with new tiles in that portal ceiling, which would improve the appearances of the other
And
second
lighting.
half.
And not saying that we aren't still thinking about restoring the original ceiling eventually, but this would be a hold us over measure in the meantime.
Yeah, but the project of restoring it and the overall cost for that is
It's
significantly.
significantly higher, and it won't be anything that happens quickly.
So we're better off to perhaps get this Band-Aid approach that would be much more attractive and make the courthouse look make the courtroom look a lot better.
Does anyone have any other questions for Andy?
All right.
Thank you.
Thank you.
Next on the agenda, Webb, After Nelson and Company. Audit. Good morning, Amanda.
Yeah, made copy of the sheets that I'll probably go over, so if you wanna take a packet, so you have something to look at.
Thanks.
Yeah.
She gave me the
Those are the hard.
full
copies.
copy,
Yeah.
the hard report.
And then there's PDF, did you send out the PDF?
I did.
Okay.
Yeah.
So
I'll-
I should
I'll
have
put-
those
I'll have
electronically.
one of these full reports in my office, and I'll put one over there in your shelf.
Very organized show.
Yeah.
Looks like maybe there's others in there.
There are. I'll go through that after the meeting today. How about that?
So I'll just go over a few of the highlights. It's always hard this time of year because, you know, you're budgeting for fiscal year 26, you're in the middle of fiscal year 25, and I'm talking about fiscal year 24. But, first and foremost, the first things in there, and I don't think I printed this for you guys, but the auditor's report, in your PDF copy, you'll see the first paragraph's the opinion, and it was a clean opinion, basically, no material misstatements or anything like that. The other part of this auditor's report, it kind of talks about responsibilities, like management, all of you sitting at the table are responsible for that financial statement. Our job is to just come in and give an opinion on it. Is it clean? First thing you have, I believe, is the management's discussion analysis, page 5 to 5G. The full audit report is 74 pages. You should really look through it, skim it. But if you don't do anything else, read this first 5 or 6 pages of the management's discussion analysis. It kind of hits the highlights. And it talks about some changes from last year. Revenues overall for the government
This is on the website.
increased about $1 million or 4.31%. So actually pretty consistent. Expenses increased about 773,000 or 3.3%. So both of those pretty consistent from 23 to 24. Back on page 5D and E. This just shows a really concise look at revenues and expenses from this year to last year. 5D is the government. 5E, you are one of the only counties that has business type with the Pasadena, Borough, Springfield. Those are all 5E. You can kind of see those that increased a lot. Property taxes, investment earnings, and then there was a gain on a sale of a capital asset. Those were the biggest jumps. Again, not a whole lot of change. It's just relative. As far as expenses, public safety was up about 450,000. Admin was up about 488. And then county environment and education was down about 345. Those were kind of the 3 big jumps there.
The county environment and education one that jumped around some because it'll depend on when conservation gets a grant or doesn't get a grant, something like that. That's usually the big ones there. The admin one, sometimes that one moves around quite a bit because like Pastina doing their project, for their sewer project, we have to pass through the money. So they get grants and loans that comes through us since they aren't an entity that can cash flow that. So we'll get money in, but then it goes out to pay the contractors. And so it makes our revenues and expenses look a lot bigger than they actually are in some of those categories.
At the bottom of page 5E is just some analysis of the individual major funds. Not necessarily gonna go through them, but the major funds for the county are the general fund, rural services, and secondary roads. So there's a little bit there on those changes. 5F on this compares your actual results to what you budgeted. There's a column there for the original budget and final budget. So based on this, receipts came in under budget by about 2.3 million. Disbursements came in under budget by about 5.8 million.
Again, that's one that
Sometimes it depends on what you get for funding, like you budget for something and the funding doesn't come.
conservation, I get their note every year that I have to explain why it's budgeted so much higher, because she likes to put in, blue sky, if $1 million grant comes in, she'll put it in as a revenue and expense, even though we don't know when it's coming or if it's coming.
But you still have to put that in.
Yeah,
Put that in.
or amend
You
it
don't
in
have to
later,
do
but
that.
yes, she
Yeah.
puts it in ahead of time, hoping, so.
Good luck.
What I wish.
Yeah.
The financial statements start on page 6. I didn't print those. I didn't print the notes. There's about 35 pages of notes. The thing on the financial statements, exhibit A and B, when you look at that, is full accrual. So you're seeing the debt, you're seeing the net pension liability, IPERS, you're seeing the capital assets. Exhibits C and D are maybe more common to what you're looking at on a day-to-day basis. The other page,
If I may.
yep,
One thing too is that we have that financial analysis done of post-employment benefits for health insurance too. So we do carry a liability for people who retire, get to stay on our insurance until they're 65. So that does carry a liability on the whole statement, and we have to pay outside entity to do that.
yep, there's an actuarial report that comes in, fill in the data, and that they create that liability. And the same with the pension liability, IPERS, the state has an actuary that does that. Report that we use for that. The next page in your packet, 68, I always like to point this one out because I think historical trends, people like to see this. This one shows a 10-year history of revenues and expenses. I think it sometimes gets buried back on page 68, but it might be of interest to you guys.
Expenditures are bigger than our income.
Then the next document I was gonna go over is the management letter. It's page 72 to 74. And this is kind of, so the state of Iowa also has certain code compliance things we have to test when we come in. And so items 1 through 10 on this are items we're required to include in this that we've tested compliance, and if we find any issues. And as you can see, there's nothing noted as far as issues with any of those for this. Item 11 has been in here since I've been on this audit. Capital asset records, and basically that's just, you don't have one asset listing. I mean, some comes from the auditor's office and some comes from the engineers, and we kind of put it all together for the accountant's piece. So it's just a lot of pieces to the puzzle. The other item was something this year, this number 14. There was a lease agreement and we found this, we actually audit our firm audits both entities. And it was just something I think, it's not a huge dollar amount at all. Just there was kind of more of a verbal agreement that was going on, different than what the actual lease was. And so I think both entities are working with attorneys to draft a new lease agreement to match what was being done.
This has to do with the sheriff and police department shared spaces. So we're using office spaces that we have a lease that we're supposed to pay X amount for. They're using our gun range, and the verbal agreement was that we would just trade, even though we have a lease on file that says we're supposed to be paying the city of Decorah for that office space. And so
We're working on getting that.
we're trying to get that all cleaned up
Right.
in writing. Yes.
So that the actual lease agreement matches what's being done.
Yeah.
Yeah.
Because technically, even as an elected official, the sheriff or myself doesn't have authority to enter an agreement like that. It has to be the board. So,
And again, overall, the dollar amount is very immaterial. It's just more.
procedural.
Right. Yep. Then I'll jump back to the graphs. Want to look through those, kind of the picture. A lot of people like numbers and words, other people like a picture. So this is the governmental funds, with the blue line being all overall revenues. The red line's total expenditures. And then we show a green line for expenditures without capital projects, because those can vary depending from year to year in funding over the last 4 years. So 2024 is on the left.
The comment that Steve made a minute ago, just if I may, the part of this is that like the ARPA money, the rescue plan money, we got that all two payments back in 21 and 22, and we're still expending it.
Mhm.
And by the end of 26, it will probably be all, well, it needs to be all the expended under their rules. So that's why we had some big years where we had a lot more revenue, but now actually have less because we're still getting that spent.
The next graph just shows your revenue by source in a picture. So the blue is property taxes, the red is the intergovernmental, green is local option sales tax, and the purple would be other. So really most are pretty consistent if you're looking at size. And the next graph kind of pie chart picks up on that and breaks down the governmental revenue for just 24 here, fiscal year 24. Property taxes in blue again at 45%, intergovernmental at 32%, local options 8%, and then these other pieces would be what falls under the other on the previous. The next pie chart shows the same thing, only for on the expense side. Starting at the top, public safety in blue at 20%. Roads and transportation, the biggest in purple there at 32%. Then the very last one is just an analysis of fund balance. Where is the fund balance? General funds over half, 52%. Rural services is at 29%. Secondary roads at 9.5%, and then the other non-major funds would be 8.5%.
And the general here in this pie chart includes the supplement, general basic and general supplemental. So we usually budget to keep the general basic at about 25%, but The supplemental usually is a little higher than that. And then what we budget, luckily, we have departments that are conservative, so they budget to shoot for 25%, and then they don't spend all the money. So then we end up actually having more at the end of the year, which is good, because then when we have a surprise expense, we have some extra money to deal with.
Any questions on anything? I would like to thank Ben and Lynn and their staff and actually all the departments who work in all the departments. So it's really a team approach. They get a lot of things to us electronically ahead of time. It was very smooth. IT brings us computers, so we appreciate all their efforts.
Just in the years that I've been doing it, it's changed a lot. It's used to be you were here maybe even for a couple of weeks because you had to look through all of these things, paper records, whereas now we provide something electronically ahead of time, and 4 or 5 days they can usually gather what they need on sites.
Usually have 3 or 4 laptops, so we can have multiple people looking at whatever we need to look at instead of waiting. So yeah, it's pretty efficient.
In your experience and looking to the future right now, what would, if you could identify our Achilles heel as a county, what would it be?
I really think it's just the funding. Who knows what's gonna come from federal and state and the cap, you know, the restrictions with property taxes. It's just unknown. Yeah.
Okay.
I think you should have a motion to accept the report.
I'll work to accept the financial report.
Second.
There's a motion and a second to accept the financial audit. Is there any further discussion? If none, all those in favor say aye.
Aye.
Those opposed, same sign. Motion carries unanimous.
Thank you.
Thank you.
Guys.
Thank you, Amanda.
Yeah.
Back up to the miscellaneous, and the first miscellaneous item is sheriff's salary discussion. What are the thoughts?
Let's review what we've done and then review the law and then have that discussion. So what we've done is given the sheriff the same, correct me if I'm wrong, the same increase that we're doing all others,
3% is what
This
we
year.
have.
3% this year. The law would dictate that we do more. I don't have that
Well, no other
percentage.
county does more.
So I want to make sure that we're all clear that we're gonna be
That part.
doing that and that there could be,
We rank about 15th, what pay scale is. 33rd.
Size wise.
Yeah. I mean, they do an excellent job.
Yes.
We're right up. We're right up near the top, so, I mean, they do excellent work. But, I guess if all the other counties were following suit is what we're doing. But the law, I mean, yeah, I don't know.
I mean, I guess I want to be clear. I think our sheriff is doing a fantastic
Yeah.
job. And this discussion has no way should influence.
Yeah.
It's more of a financial
Yeah.
discussion.
Strictly.
Equitable financial
Yep,
discussion.
we're
I'm in full support of what
yeah,
Sheriff Marks is doing.
we're kind of at our max for financial situation right now of what we got, so.
is there any, because we got rid of the compensation board that would take this responsibility on before, is there any chance of any lawsuit because we're not following legislation?
I think that was probably a question for Andy, but
Yeah.
as like Mark stated, there are a lot of counties in the state that are bucking it because they have to. You know, and we're kind of putting that same place.
Like I said, we are being consistent with what we have been doing
Yeah,
when there was a board, just.
yeah.
And you obviously, some of you anyway, have done the research and of comparing to
Yeah.
other counties, and you have the information that Dan sent out a couple of times by email, so you've weighed the options and deciding this is what's within your budget.
And it may be something they should take a look at in Des Moines, because this law was made before the House File 718 and all the restrictions on,
That's very true.
Yeah,
you know, it's,
it's hard to,
I mean, if they wanted to force counties into this salary structure, maybe they should move the sheriff's salary into the supplemental fund where they don't have the restrictions on the salary. That way you could not have to consider the consequences to all of your other departments following this one versus others. I mean, that's where you put things that you don't have control of. Health insurance costs, IPERS, social security tax, emergency management, those things are all in the supplemental fund because you don't really have control over them. And so that's why they've been authorized to use this unrestricted fund.
so I'm taking it as it's consensus amongst the board that we leave it at the 3%.
that's what I would. For now, I guess this year.
I know I'm in the minority. I would like to see us do more, but I understand the reasoning that you're offering too. I'm not being unreasonable in understanding our budget and our constraints.
I agree with, I'd like to see more, but I don't know how it's feasible. And there's too many uncertainties as to what's going ahead. We don't know. The legislative period is not yet done for this year. The impact that could change with even with the current legislation that's in place, we are really in the dark.
And we did give him a significant bump. Was it 2 years ago?
Yes.
Yeah.
So we did try our best at that
Yeah.
time.
2 years ago, it was about 27%.
Right.
Last year, it was
9.
double what the other elected
Yeah,
officials
I think you
had.
got 9%, I think, last year,
I think it was 5.5.
or 5.5.
Yeah, everyone else got 2.75 and he got 5.5.
And I agree with Steve. We're told down there now that basically plan for 2%. With the house file thing, that's, everything else is off the table. 2% plus new construction. So how that will change our look as compared to what it has been, I don't know, but that's the question we were gonna ask you then.
And this is,
Not today, but I would love to see it on a future agenda.
and this is reassessment year, which again could kick everything up, and that still puts us in that. And then there's also talk about the difference in all of the other homestead credits and everything else that continue. It's a continuing moving target.
Yeah, I wouldn't want to try to guess anything how it's gonna look
No,
until
but it's
we
very-
have some signed bills. Because I mean, they want to completely get rid of several credits that they reimburse. They want to give bigger exemptions. That means that it's untaxed dollars and those kinds of things. So, I mean, last year at budget time, you were dealing with less than 1% growth. And that wasn't because we didn't have value increase. It was because they had already shifted, like they quit doing for military people who had military service, they took the credit off and just started giving them an exemption. So I meant that it was a dollar amount that came off of the value before you even started even considering it, and it was not reimbursed anymore. So
Plus the 65.
plus the
65.
65 and older got an exemption, that additional homestead exemption, which meant that it wasn't a credit. That's it's
Just,
the vocabulary is credit is something that state will subtract off the tax bill and then pay the county. Whereas an exemption is something that just comes off the value. And so they had all these exemptions that they added to brought our values down last year. So
Okay.
they're planning to do that some more, it sounds like, so.
Yeah, it's not pretty.
Yeah, they're talking about a lot of that homestead stuff is potentially not.
And they're not backfilling any unfunded mandates, and they're just trying to add more.
And reducing services.
And I heard that they talked about changing the way the assessment limitations is the official word, the rollbacks work. And so that could completely throw a wrench in how the whole process works. And
I think there's enough wrenches in there.
yeah, I mean, this makes it next to impossible for me to even guess what basically they've decided that we aren't gonna worry at all about how much anything's worth anymore. You can spend 2% more each year. And how that works out.
It seemed to be the basics of what they're trying to tell us, just plan on 2%.
Yeah.
Plus new construction, which is then different than,
Yeah.
you're encouraged to have new
Yes,
construction.
which is different than the current rule, which is a
You're
big
penalized.
failing. Yeah, yeah.
And how much new construction do we have?
Well, that's why we need to encourage more. So that's where it goes. So
When does our letter go out, or did it go out? I didn't receive anything.
And what's the date today? The 17th. It was required to be in the mail by the 15th. I sent the information last week. It's gone. So the company has the information. Their goal was to get them in the mail on the 15th. So maybe people will be getting them starting
So
today.
the city is very misleading from what I've read so far.
So I think the important thing is that they made assumptions in the letter, which they needed to do it to some extent, but the misleading part is that everybody's letter is just going to assume that their property value went up 10%. So that's the biggest misleading portion of the letter. Another thing that I would tell people is don't really pay attention to what that's saying about your value increasing, and don't pay attention to what that means for your total tax bill, because that only includes the county, the city, and the school. It doesn't include any of the other taxing entities on there. So those parts aren't necessarily beneficial information to the taxpayers. The important part is that it does say on there what our website is, where specific information is posted, when our public hearing is, time and date and place, how they can access it online. So those are important information for those taxpayers, is that if they want more information, it's out there. The examples on there aren't necessarily beneficial, but we have that full, here's what our rates were last year. Basically this information that's up on the board. Here's what it was last year. Here's what it would have been, if you could have calculated all of it, our restriction to our levy rate, that's all posted on the website. And then again, just get information out to people that once that levy hearing is done, we'll be posting the actual expenses and revenues on the budget on the site too. So
It'd be nice to have like a county taxes 101 type article in local media to describe all of this. Just a suggestion.
the other thing was, there was a session on lots of other discussion about the TIF and how that affects. It's confusing,
it's very
but there were a lot of,
Very confusing.
they're talking about several places that have TIFs. Legally, they've sunset, but people are still operating it because some have a deadline, a timeline, and some don't.
that's the older TIFs from, I don't know when it was, but
395 or something.
yeah, did not have sunset rules, so they could
Indefinitely.
indefinitely. The ones like the city of Decorah is expanding a TIF district up like in the business park, but that one, the original one had sunsetted, but that's okay, because when basically the difference is that the frozen year, the year that you're using as the base, if it phases out, when you reactivate it, you set it at the current rate, not what it was in 1995 or 2000 or whenever it was. And so that way, in that respect, it's okay to open those TIF districts again if you update the base values. So what happens if you want just a quick reference in a TIF district, say a parcel's worth 200,000, it's a lot. They're going to build a building on there that is going to add $1 million of value, but they also need to add water and sewer lines to the parcel. I mean, this is the traditional use for TIF. So the city borrow money to put in those water and sewer lines. Tax bill comes out, the schools and the county and the assessor and the hospital only get the taxes on that original 200,000. The extra $1 million is used to pay back that debt. And so it doesn't hurt the other taxing entities, but they don't get the benefit of that new construction until that debt is paid off. So that's how the TIF was traditionally designed. It isn't always a debt that's actually borrowed money. It could be something like in the hotel wanted to build out here in Decorah. The Decorah gave them whatever it was, $400,000 or $500,000 to demolish and clean up the site. But it wasn't that they gave them cash. They gave them that much of the property taxes that were paid back after, as the years went on, to help cover those costs. So
there was a difference in if it was for urban renewal as compared to expansion. They have limits on, automatic limits on time.
We don't have anything going still in TIF, do we?
Oh, we have several TIFs. In Kelmer, we have the Pivo Brewery property was established as a TIF, and they just added one. I'm sorry, I can't think off the top of my head. In Decorah, we have the auto dealership, and they're still paying off that money to the hotel. They have those apartment bluffside gardens. That's what it's called. Those rentable apartment buildings. Yeah. That's in the TIF district. And Hy-Vee is in a TIF district.
About the new apartments up by.
Those are not.
Which auto dealership? Car
auto.
52 and 9.
Yeah. So those are, all of those are set up as what's called a rebate agreement, where they are pledged a certain dollar amount of their initial investment as a rebate of the property taxes they pay to encourage them to do development. Those are a little different in that they are limited, like we're going to pay you whatever it is, $100,000 a year for 5 years if you do this development. So then in my example, if it was a $200,000 property and they added a 1 million property, but they only need what the taxes are generated on 400,000, the other 600,000 goes back into the base, and all of the other taxing entities still get to use it. So those rebate agreements don't have as big an impact, whereas like out at Pivo and can't remember what the other one is in Kelmer. Those were actual, like the traditional one. They had to build roads and expand their sewer and their water. And so they're taking all of the money those districts can generate to pay those loans off that they incurred to do that development.
So the impact on our finances is small because it's primarily within city limits on most of this.
It's true, but they still
impact.
affect the general fund, general and supplemental fund. I mean, the important, I guess the I don't want to defend TIFs. I mean, it's a useful development tool. The important thing is, it doesn't ever negatively impact you, but you may not reap the benefit of the positive impact as soon as you would have otherwise,
But the assessed valuation will go up and impact us in that way.
Yeah, and all what portion that gets assigned to the TIF district that happens before we do this comparison. So I do that that's part of the November and December when I'm doing the valuation report. They have to file with me by December 1st. It's usually, they don't wait till the last minute, but how much TIF revenue they've either pledged as a rebate agreement, or if they still have loans, how much outstanding loan balance, and then I calculate that off of the total value before I get to the point where we do this calculation.
Sorry to get us off.
Yeah, no, that's okay.
Sidebar on our discussion.
Yeah, no, it's important to know this, that yes, TIFs can have, play a part of it, but we have, I think there are 4 or 5 in Decorah, and there's now 3. The new one is called like TM Holdings or something. I don't know what it is. They haven't done anything yet in Calmer, but they have 3 in Calmer. Dollar General, the Dollar General property, the Pivo, and then this new TM Holdings, whatever that one is. So even though there's like 8 different ones that I have to manage and do the paperwork on, the total dollar amount it actually affects your total taxable value is pretty small. I mean, we don't, and almost all of them are commercial properties, and commercial properties anyway have a very small portion of our total. I mean, residential and agricultural properties make up the vast majority of our valuations. So.
Okay, let's move on.
Yeah, that's right.
Letter of support for Decorah Fiber Project.
I did not do anything with this other than add it to the agenda. I didn't know if any of you are interested in pursuing that letter. They had sent a sample with the email. Did you see the email?
Yes.
Okay. So I guess it's up to you whether you want to even address that today or
When does
not
that
address
letter
it.
have to be done by? I thought it was.
I thought it was
Yeah.
noon that
Yeah, 'cause
Wednesday.
it said March
Yeah, it was,
9th, 7th or whatever.
yeah, it was that day.
But I thought, oh, maybe that was just in the sample, that was the date they put it.
Maybe, I don't
but
know.
I don't know when the deadline actually is or was. That was my confusion on that.
No.
By the time I looked at it, it was the next day after that went out, and so
The way I understood it had to be done
yeah,
that.
so I don't.
Okay,
Yeah, I
so
think they.
So at this point, it's maybe nothing we need to worry about.
No.
If
they
someone
feel it's
is interested, wants to contact Travis or Lorraine or somebody and ask if they still need it or want it. And if it needs to be on next Monday's agenda, just let me know. Otherwise, I'll consider it.
I'd like to see it happen.
well, maybe someone could ask that question if they want to go to this March 20th meeting at 10 o'clock. The city council chambers about the Decorah Business Park Urban Renewal Area. They have an amendment.
Okay, this would be backing up one subject. This is back to TIF. So this is a new one they're planning to set. Yeah.
Yes.
And they are required to notify the other taxing entities, because if they do the TIF, you don't get to reap the benefits of the increased value right away. And so you get a letter to be able to go to that public hearing.
This is probably in relationship to that new business it's developing. Is that why?
It would be a new development, yes, and I don't know if it gives what.
It was like 5 acres or something that they're using.
Is anyone interested in attending?
It's March 20th.
Yes. 10 o'clock.
7.
At what time?
Yeah, 10 a.m.
I think I can. You just give me that.
Yeah, I'll give you this. Okay.
At least you can find out where it is and what the project is and
Yeah.
report back to us.
Well, then it gives us the opportunity, if you want to make any written recommendations, you have 7 days after the meeting in order to submit that.
So
And then their public hearing on it was 5:45 on April 7th. So,
So the meeting is on the 20th at 10,
yes,
and it's at the chambers.
Yep. council chambers.
I might, if you.
That's true.
Can do that.
Thank you.
All right. Through all that, I guess we still have a few other things. Consent agenda?
All I have on consent is the minutes.
I move to approve the consent agenda.
You take your pick. We have a motion and a second to approve the consent
I
agenda.
put Steve, I heard him louder, but you know, he's right next to me.
We've been spending too much time together.
All those in favor, say aye.
Aye.
Those opposed? Motion carries unanimous.
In time, the recycling seems to be doing well. And I think our staff is in place. Already making a few changes and adjustments. Rural waste seems to be still working out some issues with that, but I mean, overall, I think it's a positive thing and integrating well into the recycling part of it, so.
Morale seems to be improved.
Yep.
And on that note, we had the security board meeting and we had recycling show up at it. We were going over the changing of the locks and ultimately we're gonna enter a fob system out there too.
Oh, good.
That would be for just the employees. There'll be 2 or 3 with keys and then Malcolm actually has pickup early morning, so they would have a fob. But with that fob, you can program in the hours when any of them operate, so it really take care of that.
Who hit, where does the cost land? Which budget?
Well, we discussed that. We're probably gonna push it over until the next fiscal year before we implement all of it.
We got a lot of deferred maintenance that we have to deal with down there. We're watching, but
And there's only about 20% of the budget left.
Yeah.
I know.
So, yeah, that was also discussed, so.
I think they were gonna just do the keys right
Keys
away,
right now.
and then worry about doing the fob and the upgrade when there's more money available.
Problem is nobody even knows how many keys are still out there and it hasn't been rekeyed, so there's
Exactly.
dozens of keys floating around probably.
And on that note, then we also talked about the building down here. And there will be one access point with a key fob installed. That will be for the staff only for the DHS, HHS, whatever you want to call it. And that will be there. And then the others will have coding box.
Yeah.
So that's what we want to have.
Yeah, they sent out an email that by the 20th, now they'll have all the desks marked that they want to take and they got a blueprint here where to go.
We sent this out real nice.
We can,
A doorway to break room, need sound barrier. This one here, need 2 desks moved. So they're getting.
yeah,
stuff put
there,
together.
yeah.
Great.
So we may run Friday morning or something, just take a look at everything they got marked. See if we can start moving some
I'll
of
be
this
glad
stuff
to
at
get
any
them in.
time.
Just so everyone knows that Hacker Nelson, that full report that I put a paper copy on your shelf is on, I put that on the website, on our county website, in the auditors section under the additional information tab. There's the last 15 years worth of those, including this newest one.
Then you said we have extra tables down at the community building, is that right?
Well, we'll just have to look at, see how many there is, what they have. Most of them are the old wooden or the old metal.
Oh, maybe things.
Not the fancy.
Oh.
There's about half a dozen of these newer ones. And some of those are probably better than the old wooden ones.
Yeah.
And if there are other places in the county that could use them, otherwise we should probably just get rid of them.
Well, it's pretty bare in there right now.
Yeah, we'll need to meet with all of the entities.
We'll just wait till we get done moving here and see what we.
See what's left.
Out there.
Yeah, we've got a couple of folding tables that might go away out of recycling.
There's a bunch of that stuff out there, the communities or the DHS building too, the tables and chairs that ain't gonna be good. In their break room, there's a bunch, I mean, yeah. We'll just wait till that move gets done, then we'll.
There's a lot of stuff out there.
Yeah.
Did upgrade the chairs around the conference table, which was,
At recycling.
you know, at
Oh.
community services,
Yeah, we did. That was a good improvement.
very much so.
Any other committee reports? I forgot my notes for conservation. I will apologize and I will bring them next week on that.
Workforce Development Board, I've got a meeting on Wednesday.
I've got the housing meeting at 1:30 on Thursday.
Policy board Thursday at 11.
Muncie County Development Tourism meeting. Thursday, that's
What time is that one?
noon, I believe.
When's that, 10? No.
Coal Bank and Trust.
That addition, that second building. Okay.
Yeah. Am I missing anything?
No.
Move to adjourn.
Second.
I beat Mark.
Yeah, I guess that is.
There's a motion and second for adjournment. All those in favor say aye.
Aye.
Meeting is now adjourned.
The meeting date.
I don't know, 15.
We'll do this time on the stuff out of there. But that's really. We're gonna have a house up there.
Yeah. That's the head of it.
Yes, sir.
Sure.
Yeah, we kind of. Share the resolution. Just on top. I was looking. You good to work.
You looking for the timer?
And the bids are due and the bid, all that.
Yeah.
So.
It will also be sent to the newspaper publication, but I'll get it to you for a story.
Thank you.
I did. They're just leaving it at 3% that's currently in the budget.
But then it was all
What they put in the budget originally, and there was no action to change it, so we're just leaving it at 3%.
Which one of us runs the remote?
I can run the remote. And even if we only have one.
Yeah, thank you.
Then it goes.
Yeah, thank you.
Yeah.
We've got an alarm after the time.
Pretty sad, actually, because I sit there and she's in pain, it's like, look, can't do anything.
Takes the ambiguity out of it.
Yeah. Yeah.
Because you hate to be giving one person more time than the other, and looks like you're picking favorites.
Come back to haunt you.
Yeah.
So see you next time. Like this.
Yeah.
Cut up the different classes.
I can't.
Oh. Yeah. But they actually had to give it a Mountain Dew Thursday night.
For the captain.
Yeah, but she thought she wanted some, but then she was puking so much that she did really good. Yeah, so,
We had to move that.
yes,
In the initial.
that's right.
Did I say the word?
So, yeah, the good news is she can get up out of, I mean,
She's walking.
walking around, get up and
See if you'll say.
how soon she could get up and
It's wonderful what you
the
do.
back part is not the issue at this point, so, yeah. There's only 2 supervisors left, thank you.
We're done.